Today we're going to talk about the cardiovascular system. In order to be effective, the cardiovascular system needs to have input from both the electrical and mechanical systems. So the electrical system is what causes the electrical current to go through your heart in order for the mechanical process of cardiac contraction to occur. So it's kind of like if you plug in your toaster, but you never push the button to have the toast go down. The electrical part is working, but the mechanical isn't. And if you did not plug in your toaster, but push the button to have the toast go down in the old non-electronic ones, the toast would actually go down, but it wouldn't cook because there was no electric component to heat the bread. So your heart has to have both the electrical and mechanical systems working together in order to have good function. Whenever somebody appears in the ER and they are having any kind of chest pain or chest discomfort, this is considered a medical emergency. And the reason for that is until we get cardiac enzymes back, do EKGs, and monitor the patient over several hours, we don't know if they're having a heart attack or not. So any patient who presents with, with symptoms such as chest pain, chest discomfort, we're going to treat them as a cardiac emergency and treat them accordingly. Those patients need to be brought back, and the triage nurse will take vital signs and get them back immediately. They most of the time will put that patient into a code room just in case anything gets worse or that the patient's condition actually deteriorates. And the event that they would code, then all the equipment would be there, and the code rooms are much larger, thus allowing everybody to be able to function without climbing on top of each other. So the electrical system can go bad, and in that case, many times the patient will need to have pacing, which means that they will need a pacemaker, whether that's an external pacemaker that can be put on or a temporary pacemaker that is actually thread into a their left ventricle through a catheter that is inserted in their brachial artery, and or whether the patient will need to eventually go for a permanent pacemaker. Anytime someone has a temporary pacemaker, they will ultimately get a permanent pacer unless it is drug induced. So a patient that's having an electrical problem, we need to be really careful and monitor them, because at any point their electrical system can fail, thus causing them to not have mechanical, which is an actual contraction, beating, producing a pulse, and they can have a cardiac arrest. So these patients need to be monitored constantly, and the ER tech needs to be nearby so that if chest compressions need to begin, they can do that promptly. Patients can have conduction system problems that aren't as dramatic as having a cardiac arrest. And those patients need to be monitored, maybe given medications, possibly a temporary pacemaker, but they can always deteriorate and get worse at any point in time. Now, the patient who's having a mechanical problem would be anyone who's having chest pain and they have EKG changes. If they have ST segment elevation, which would be seen on the EKG that the ER tech would be performing, the ST segment elevation would be called a STEMI, a ST segment elevation myocardial infarction. And the event that a patient is having a STEMI, cardiology is called and a cardiac cath is done immediately, and the patient is gotten to the cath lab promptly, being moved there probably by a cath lab person along with the ER tech, and helping get the patient positioned onto the cath lab table. So the ER tech's role is really important. The ER tech may even be responsible, if the ER is busy, to call cardiology to get them there, because the sooner the cardiologist gets there and stents that vessel, the occluded vessel, the more successful the stent is, thus resulting in much more perfusion and less damage to the actual heart from the lack of blood supply, which causes a lack of oxygen supply.